Now all the wax outside this line has to be removed. So I first start with the cervical cuts. Give cervical cuts on all 4 sides of the tooth. Cervical cuts help us to reduce the dimension of the crown at the cervix. At the same time, it also gives us an idea and helps us develop the shape of the tooth. After you make the cervical cuts, remember to merge the cervical margin onto the labial surface so that no line is formed at the cervical margin. If you don't merge, then there will be a distinct line that can be seen onto the labial surface. The canine also develops from 4 lobes, and the middle lobe is always well developed. So when I gauze, the middle lobe of the canine has to be well developed as compared to the adjacent sides. Now you can see that there is a well defined central line which I have not carved. This I have done because I have carved on either side of the line. So there is a midline which is extending from the cervical margin to the cusp. I have not carved on this line. I have carved only on either side of the line. This will help me achieve this bulk of the middle lobe. After I have finished carving the labial surface, I will continue reducing the length of the mesiodistal. So I have marked the mesial and the distal dimension. I will continue with the lingual convergence. So what is lingual convergence? It is when the crown converges onto the lingual aspect. For creating lingual convergence, the carving should be carved more on the lingual and less on the labial. So if you notice, I am carving more on the lingual and less on the labial. I do the same for the opposite side. I carve more on the lingual and less on the labial. I will again gauze from the labial to the lingual. From the labial to the lingual. With that, I will achieve lingual convergence. I continue to reduce the dimension of the maxillary canine. I remeasure the 10 millimeters on the divider. Check the length of the crown. So the length of the crown is fine. Check for the mesiodistal diameter, that is 7.5. Put the divider on either side of the midline and mark 2 points. These 2 points are the dimension mesiodistally. So I will draw a slight line on the carving. All the wax outside these lines has to be removed. So I will start removing the wax on either side of the line. So I am removing wax to get the tooth within the line. So you can see this line, I have removed wax just beyond the line. So all the wax that is beyond the line has been removed. Now you can see the shape of the tooth taking place. I do the same on the opposite side. I do the same on the opposite side. So now you can see that the tooth has started taking the shape of a canine. I gauze the crown again. Now you can see better. See, the shape of the canine has already started being visible. So you can see the tip and you can see the lines that are making the tooth look like a canine. Also, the middle lobe is very well developed, which is the characteristic feature of maxillary canine.